Andy, at Cancer Geek, here we are at Intermountain Health at HIM 16. Man, it's good to see you. How are you doing?
I'm doing really good. How about yourself? It's always great connecting with you again.
Oh, thanks. It's awesome. I want you to tell me what I keep seeing this hashtag you're driving, my ideal patient experience at. It's hashtag my ideal PTEXP, right?
Yep, exactly.
Tell me what is that?
So my ideal patient experience is really about putting the patients back into healthcare, the me into medicine. And the way that you do that is actually partnering with patients and using not just their expertise in their diagnosis, but also their expertise in their daily lives. They're engineers, they're coders, they're programmers, they're designers, because that's the tool set that healthcare needs to actually create an ideal patient experience. So, and from our experience in this, we've really sort of decided that it comes down to four big topics. So it's, hey, spend enough time with me, so we build the trust, let's have a transparent conversation, and then help me manage my transition through my journey as a person, and then as a patient.
Awesome, and you've got some cohorts in this, some team members on that My Ideal Patient Experience. Who are those?
Yep, so Gia Sassone, she's a medical physician, she's based in the Philippines. Maria Ennis O'Connor, she's our Chief Marketing Officer, and she's based in Ireland. And then we've got Stacy Tianov, so she's over on the West Coast. I have Andrea Brande Kitts in the East Coast, and then everyone knows the wonderful Mighty Casey.
Yeah, that's great. You guys have got a global reach already. So.
Yeah, we do. And I think that's important, because patient experience it's different things to different people based on where you are sort of in the world.
Awesome. Tell me, who are some of the early adopters in the system side? I know at Intermountain we're here and they're awesome at things they're doing, but when the work that you do with GE, from your purview, you get to see a lot of systems. So who are some of the early adopters that you see are really getting behind this whole patient experience, patient involvement?
Yeah, so as you said, from my perspective, I think UPMC, I think a lot of the work that Rasu is doing is amazing, it's impactful, it's making a difference. Kaiser, definitely the Mayo Clinic and the Center for Innovation is doing some really amazing things. And then of course the other standby with the D School and their medical college and whatnot is Stanford.
Awesome, yeah. What are some of the I don't want to say the emerging or evolving digital health technologies or mobile health. No, what are some of the stuff that's out today that's being used and deployed? What are some of the favorite technologies that you think are really helping win patient engagement?
Yeah, so I think one of the big things is that, hey, I have this question now, so I need an answer. So, Doctor on Demand.
I need an answer now.
Yeah, exactly. And hey, if I'm not feeling well, I don't want to drive someplace. So I think Doc on Demand, they're doing some great stuff. And I think what's really interesting is that the more and more I think about, time, trust, transparency, and transitions, the video aspect. So asynchronous video it's amazing because it captures that moment in time that can be relived, and it really builds that trust and that transparency. So I think there's a lot of different things. I think what will be truly unique is who sort of comes in here and says, from a person and when I become a patient, how do we put all of these apps together and then help me live my life better?
Right. I like what Bill Bunting said about building a Plico system. So that's going to have to happen. There's just too much cool stuff out, and they're not all going to make it, right? So big groups are going to build their own little Plico system of saying these are the apps to use. Any favorite mobile apps right now that you have in healthcare?
So I kind of already mentioned it, but Doctor on Demand, I think that is so cool. I kind of tried it out the other day because I wasn't feeling that great, and it was perfect.
Get your phone out, see a doctor.
Exactly.
Kind of a no-brainer.
Yeah, I think some of the other ones are, even from a sort of knowledge perspective, there's a lot of cool things that Picori's doing that you can get access to. There's a lot of cool things that the Barrel Institute's doing around patient experience and being able just to sort of solidify and have a place that, people like us do things like that it's in a simplified language that I, who may not necessarily be a healthcare professional, it's simplified. I get it.
Yeah. What's on your to-do list today at HIMSS? Who's a must-see for you?
So you mean besides you and Bill?
Oh, no, right. Come on. Thanks.
So for me, just shortly after this, it's Susanna Fox.
Yeah.
I think Susanna, she is an amazing woman. She's a fierce leader, and I think she's really doing some great things with HHS, especially around the Ideas Lab and sort of
Yeah.
this incubator. So I'm super excited that she's here. So that's kind of my to-do list, number one.
Awesome. I think I'll go with you.
Yeah.
All right. Hey, Andy, thanks for joining us today. Good to see you. All right.
See you soon.
All right.